نستمر على questions and answers in surgery. اليوم نناقش الانجوانال هرنيا. الانجوانال هرنيا. Which structures are located on the floor of inguinal hernia? Floor of inguinal hernia. شنو موجود بالفلور اوف inguinal hernia؟ يعني اوكي suppose this is the iliac crest, this is the inguinal ligament, this is the pubic symphysis, internal ring, and this is external ring. What is the floor of an inguinal ligament? Okay, the floor of an inguinal ligament. Here, from here to here, spermatic cord, which come. This is spermatic cord. Okay, this is internal ring. This is external ring. Pubic symphysis. Okay, this femoral artery. This is external iliac artery, and this is inferior epigastric artery. Inferior epigastric artery. Okay, here should be the hernial sac. Can be here. This is hernial sac, or it may come here. This is the indirect, and this may become indirect and direct even. This is rectus abdominis muscle, and this is Hasselbalch triangle. Okay, so what are the structures? The structures here in the floor. Transversalis fascia in the floor should be transversalis fascia, and the conjoint tendon part of internal oblique muscle, while this inguinal ligament is part of is external oblique, fold of external oblique. Okay, so transversal fascia and conjoint tendon, transversal fascia, conjoint tendon structures found on the floor of inguinal ligament. Which nerve run in and it's posterior to the spermatic cord? Which nerve run here? This is spermatic cord. Posterior to the spermatic cord, here is the nerve. Posterior to the spermatic cord, here is the nerve. Okay. The nerve. Which nerve is here? This is ilioinguinal nerve. Okay. This is mainly the nerve that go there. This ilioinguinal nerve directly come into where? Externally. But the nerve posterior to spermatic cord, is genital branch of genital branch of genitofemoral nerve. Genitofemoral nerve. So here are two nerves, ilioinguinal externally and the posteriorly genital branch of genitofemoral nerve. What comprise the Hasselbalch triangle? What comprise the Hasselbalch triangle? Inferior epigastric. This is inferior epigastric vessel. This is the wall of, border of rectus abdominis muscle and the inguinal ligament. This is Hasselbalch triangle. The hernia inside the Hasselbalch triangle called direct hernia, while that outside the Hasselbalch triangle from internal ring called indirect hernia. So, what type of hernia goes through Hasselbalch triangle? What type of the hernia go through Hasselbalch triangle? What type of hernia go here through Hasselbalch triangle? Here we called it direct hernia. Okay. From which abdominal muscle layer is the cremasteric muscle derived? Cremasteric muscle, which cover the spermatic cord. Cremasteric muscle cover the spermatic cord. Okay. From which layer? قلنا الانguinal ligament from external oblique. The cremasteric muscle that cover the cord is from internal oblique. Okay, internal oblique. From which muscle inguinal ligament derived, or what we call Babor's ligament? It's from external oblique. Which nerve travel the spermatic cord? Nerve travel the spermatic cord, as we told from the first, is what? This ilioinguinal nerve. Ilioinguinal nerve. Okay. What is the spermatic cord? What is in the spermatic cord? The structures that pass in the spermatic cord, what are they? They are cremasteric muscle, but vas deferens, testicular artery, بعد testicular venous plexus, بعد genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. Okay, these are the structures in spermatic cord. Cremasteric muscle, vas deferens, testicular artery, testiculus venous plexus, and genital branch of genitofemoral nerve. What is a true conjoint tendon? True conjoint tendon. True conjoint tendon is tendon from transverse abdominis and internal oblique. Transversus abdominis and internal oblique. This is heteroconjoint tendon. Internal oblique aponeurosis joined with the transversus abdominis aponeurosis. And this present only 5%. Sometimes the surgeon mistake conjoint tendon اللي هي إذا if a transverse abdominis aponeurosis alone attached to the pubis, mistake the conjoint tendon, only transversus abdominis. But a true conjoint tendon is from internal oblique and transversus abdominis aponeurosis. Okay. What's Cooper's ligament? Cooper's ligament is here. Periosteum of what? Periosteum of superior rami. This is superior ramus, this is inferior ramus of pubis. And the periosteum here called Cooper's ligament. Periosteum here called Cooper's ligament. This is superior pubic ramus and this is inferior pubic ramus. The periosteum here is called Cooper's ligament. Suppose this is the ramus. Periosteum called Cooper's ligament. Okay. What is the hernial sac made of? Hernial sac made of peritoneum. Peritoneum or process vaginalis. What attached testicle to scrotum? Attached testicle to scrotum, what we call gubernaculum. 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 Structure that attached testis to scrotum. What are the remnants of process vaginalis around the testis? Remnant of process vaginalis around the testis we call tunica vaginalis. Tunica vaginalis. This is tunica vaginalis, remnant of process vaginalis. And this inside white called tunica albuginea. What could be yellow tissue on the spermatic cord? Testicle that is not fat B. if there is zero tissue on the spermatic cord, or testicle, which is not fat. Here, yellow tissue, spermatic cord or testicle, which is not fat. It can be what? It can be remnant of adrenal tissue. Remnant of adrenal rest, what we call adrenal rest. يعني بقايا من الادرينال. Okay. What's the most common organ in inguinal hernia in men? Most common organ come in inguinal men is a small bowel. Most common in men. Most common organ come in inguinal hernia in men. While that in women, most common organ in women should be ovary. Okay? Or fallopian tube. What is instead of vas in inguinal hernia in females? Inguinal hernia, inguinal instead of vas, here should be what? Round ligament. Round ligament. And then inguinal canal. Where's the direct hernia sac? Where's the indirect hernia sac located in relation to the other structure? Usually the direct hernial sac, indirect hernial sac, located indirect hernial sac, usually what? Usually located anteromedially, inguinal canal. Indirect hernial sac usually located anteromedially. What's cord lipoma? Cord lipoma, lipoma of the cord, is peritoneal fat which pushed by the hernia. Lot of fat pushed by hernia. It's outside the hernial sac. Peritoneal fat, what we call. This is called cord lipoma. What's the outpouching of testicular tissue of testicle? What we call testicular appendage, outpouch of testicular, usually here outpouching of testicular tissue, سميها testicular appendages, which can be excised by cautery. This is testicular appendages. Okay. Thank you very much.